Brinda Rao is a registered dietitian and a certified diabetes educator with international experience. She's passionate about nutrition and helping people improve their eating patterns and their overall health. So, thank you for coming today. Um, I'm just going to dive into some questions so you can educate us about heart health and nutrition. So, can you tell us about the importance of nutrition in heart health?
First of all, thank you, Dawn, for having me here today. It's indeed a privilege. So, nutrition plays a very important or a crucial role in maintaining heart health and lowering and preventing cardiovascular disease. So, for instance, it helps to control blood pressure. It also helps to regulate your cholesterol, your blood sugars. It can help to manage your weight. It can help to reduce inflammation, and this helps to and also help combat the oxidative stress, which are both linked to atherosclerosis. So these are some of the some of the important functions of good nutrition that can help to prevent and lower cardiovascular risk.
Thank you so much. What do we need to know about eating healthy for our heart? Are there specific foods or beverages that we should avoid or ensure that we include?
So as a registered dietitian, I tend not to look at a single food rather than what the evidence shows. So more or less the eating patterns. So what the evidence shows is eating patterns such as the Mediterranean diet, the
Mm.
DASH diet, which is an acronym for the full form of the dietary approaches to stop hypertension, the portfolio patterns of eating, and Nordic diets. So when you kind of summarize the eating patterns in each of these uh, um, diets, they emphasize basically on vegetables, fruits, whole grains, legumes, nuts, seeds, plant proteins, so things like tofu, beans, soy, and fish. And they limit added sugars, saturated fats, and salt.
Sounds delicious. I love all of those foods. So there's a lot of misinformation out in the internet in the world, and a lot of trends that kind of steer us away from maybe what are the basics or the facts. Can you tell us how can we navigate all this misinformation and trends and really eat so that we can maximize our heart health?
I think this is a very relevant question and very apt for today's world. There is so much out on social media, people, blogging, TikTok, Instagrams, and everybody giving various advice on just not only on heart health and nutrition, but lots of other things as well, as far as nutrition is concerned. So, some of the most important things is to look for some credible sources. So, some of the credible sources for nutrition, of course, you have locally the Alberta Health Services, we have the Dietitians of Canada website, we also have the Canadian Cardiovascular guidelines and their website as well. So these are some of the credible sources of good evidence-based information. The other most important thing is to look for some red flags. So if people are trying to sell you supplements and are trying to sell you something, their products, then of course, they're red flags. And when something is too good to be true, that's the other thing, right? The third thing here is, when they're trying to kind of glorify one food, superfoods, um, we don't look at any one particular food, but we tend to look at the dietary patterns. What do you do over, a couple of months? What are your patterns? Because that is very important. And the other important thing is when you're in doubt, go and talk to a registered dietitian, because they can help you navigate this very confusing world of nutrition. And honestly, Dawn, even for us as dietitians, sometimes the amount of misinformation that gets thrown out is quite appalling. So it's really really important to make sure you go to these some of these credible sources.
I think that's amazing information. So you kind of touched on superfoods and I did have a question about are there heart healthy foods that are overlooked? And obviously, we don't want to go overboard on any food, but are there anything that we're overlooking maybe in the Western diet that we could incorporate easily?
I think one of the biggest things that I see or a gap when I talk to patients is about, the plant-based foods, things like legumes, lentils, soy, tofu, and these foods can be very easily incorporated with, your current patterns of eating. Um, it's very easy for me to say incorporate these foods, but to get into those day-to-day cooking where how can how can I use beans, how can I use tofu, so I think that this is where your dietitian can come or play a very important role to help you kind of nudge you to make these nutrition changes. You don't have to go to like turn around 360 degrees to completely overhaul your diet. It's those small changes, consistent changes that make a huge difference in the long run.
Amazing. So it sounds like it has to be a very personal journey to sort of eating more healthy patterns and maybe you can touch on, is there room for any treats, or do we have to you kind of already did, but can you give us a little bit of hope that, we can have some of the favorite foods that we love?
Absolutely. Absolutely. These negative connotations to food. This is good food. This is bad food. It's not the way view food. Of course, food has so much of importance when it comes to celebrations or, cultural celebrations, social gatherings. And of course, it's all right to include these treats. It's just the overall patterns again. How often are you including these foods? Is it on a daily basis? Is it on those special occasions? So of course, treats have a place in, your overall eating patterns. Um, and you just very aptly captured it when you said that it's highly individualized because everybody doesn't eat the same. Right. So it's really important, to sit down, figure out what your eating patterns are, see the dietitian, and then figure out, where can these treats fit.
Amazing. Um, so I guess in the healthcare providers, practitioners scheme of things, I think a lot of people don't think of chatting with a dietitian. So are there any tips that you can give to find where can we find a dietitian?
Um, there are registered dietitians within the Alberta Health Services. You have dietitians located in the primary care network. You also have private practice dietitians. So for the private practice dietitians, if you have a extended health care plan that covers the dietitian profession, it's just easy to find them on Google. And the other thing I wanted to say is in Alberta, the title of nutritionist is also protected. So it is registered dietitians or registered nutritionists. Not all provinces, but Alberta is one of those provinces where the title of the nutritionist is, it's protected. So similarly, we have to undergo the 4 years of rigorous training and then do the internship, write the exam, and get the license to practice. So that's something important that I think people need to remember. Um, One of the things I always tell people is, when you have a toothache, you go to the dentist. You have a heart issue, you go to, your doctor, you go to your, heart specialist. So when it comes to food, why don't people go to the dietitian? That is something that is important to remember.
Amazing. It's so true. Um, if you go to a dietitian, is this something where you can expect them to kind of walk you through some new recipes and that sort of thing? Like obviously it would be again very personalized, but is there practical? Like can they actually give you delicious recipes?
Absolutely. So a lot of people think dietitians are food cops. We are not. We work with, the individuals based on where they are, what their eating, habits are, which culture they come from, because it's so important to incorporate those cultural foods, foods that I've grown up with. Definitely when it comes to recipes, we have tons of resources where we can give you recipes, and maybe you have a cultural recipe that you love, and maybe there are some ingredients which may not be, great to use on a regular basis. Can we modify that? For sure, we can add something, substitute. So we can modify recipes for you, your favorite recipes as well, or we can give you some new recipes to try. So again, it's a work in progress. I always tell people Rome wasn't built in a day. When you went to school, you didn't go to school, right? From grade one straight to grade 10. So as long as people are consistent, they have that patience. I think, nutrition can really, really improve their health.
That's amazing. So if you could give just one tip to people to improve their heart health through their eating patterns, what would it be?
I think one important thing, which again, maybe I'm repeating, but it is that whole plant-based foods. So including fruits and vegetables, your, nuts and seeds, the legumes, the lentils, the soy, the healthy fats. Um, and people often, kind of get fed up now. Isn't there
Mm.
something else? But this is the basics. And to incorporate this in a way that fits into your eating patterns. And we're not talking about yourself. Perhaps, you have a family to feed. So how can you kind of sneak these foods in or add these foods into your, daily routine? So that is very important. So to get those fruits, vegetables, whole grains, nuts, seeds, healthy fats, the soy, the lentils, and legumes.
So no magic pill for us, unfortunately.
No, this is, yeah, this is, just basic healthy eating. And I said because the world today has so much of, information. Oh, this food is good, this food. But when you actually come down to it, when you look at all the evidence, it's the simple basics. And there was a review that was done in Lancet a couple of years ago. Worldwide, the population now, they don't eat enough of fruits, vegetables, whole grains. Um, it's That's really sad, right? So I think once we start getting down to some of those basics, and incorporating them into a way that fits for us, that makes sense to us, I think we'll overall do a lot better in terms of our overall health as well as cardiovascular health.
Awesome. Well, thank you so much for all this great information and um yeah, just sharing about the importance of a basic diet and just making simple changes, not trying to completely overhaul everything at once. I think these are great tips and I really appreciate you sharing them with us.
Dawn, thank you for having me, and to all the viewers of today's vlog. It's wonderful to meet you all over a video session. So thank you so much.
Thank you.